The cardiopulmonary resuscitation should be option A 2 inches per second, option B 1 inch per second, option C 2 inches per 5 seconds, option D 2 inches per 3 seconds. Option A, that is 2 inches per second. The healthcare provider should take more than 10 seconds to check for a pulse. The healthcare provider should take more than 10 seconds to check for a pulse. For example, carotid. And if the rescuer does not definitely feel a pulse within that time, the rescuer should start compressions. The 30 compressions are delivered rapidly at a rate of at least 100 per minute. Compressing the chest of an adult at least 5 cm, that is 2 inches, and allowing complete recoil of the chest after each compression. 30 compressions should take approximately 18 seconds. 30 compressions should take approximately 18 seconds. The reference is from Medical Emergencies in the Dental Office, Stanley F. Malamed, 7th edition, page number 490. Question number 51. A patient with Lefort 2, Lefort 3 and nasoethmoidal fracture with intermaxillary fixation then is best intubated with option A nasal intubation, option B oral intubation, option C submental intubation, option D all of the above. The answer is option C submental intubation, because you are having IMF, so you can't go by oral intubation. You are having nasoethmoidal fracture, so you can't go by the nasal intubation. The best is submental intubation. In maxillary fracture where there is no skull base involvement, nasotracheal intubation allows adequate access. However, where the upper mid-face is involved and a coronal flap indicated, either submental intubation or tracheostomy is recommended to ensure a safe and unencumbered procedure. Where it is envisaged that airway support will be required for short duration, the reference from Peter Ward Booth, Maxillofacial Trauma and Aesthetic and Reconstructive Surgery, page number 243. Question number 52. A patient with extracted third molar complains of loss of blood clot, pain with no fever and swelling is best treated by option A the irrigation of socket with sedative placement and analgesic, option B curettage of socket and induce healing, and induce bleeding, option C left untreated and observed for 6 days, option D start antibiotics followed by curettage of the socket. Option A is answer is option A, that is irrigation of socket with sedative placement and analgesic. Treatment is straightforward and consists of irrigation and insertion of a medicated dressing. First, the tooth socket is gently irrigated with sterile saline. The socket is gently suctioned off all excess saline, and a small strip of iodoform gauze soaked in or coated with soaked in or coated with the medication is inserted into the socket with the small tag of gauze with the small with a small tag of gauze left trailing out of the wound. The medication contains the following principal ingredients: eugenol, which obtunes means pain relief, which obtunes the pain from the bone tissue, and a topical anesthetic such as benzocaine, and a carrying vehicle such as balsam of Peru.